Welcome to this month's edition of Focus on Health. I'm your host, Dr. Barbara Brookmeyer, and today we'll be talking about food allergies in children. And our special guest is Terry O'Gwyn Harris, the director of the School Health Services Program at the Frederick County Health Department. Terry, welcome. Thank you for joining us.
It's great to be here.
Great. Well, let's start with, what is a food allergy?
Food allergies occur when the body's immune system targets a food protein and as a threat and tries to destroy it.
Well, how common are food allergies? So say in Frederick County Public Schools, how many students have a documented food allergy?
There are over 1,700 students with food allergies.
Wow. Wow. So what are some of the symptoms of a food allergy?
For those experiencing mild symptoms, you may see sneezing or a runny nose, a congested nose, red, itchy skin called hives. Those are some of the symptoms for mild. For severe symptoms, it's a medical condition known as anaphylaxis. It's potentially life-threatening, and those symptoms can be vomiting, shortness of breath, losing consciousness, swelling of the lips, the tongue, the throat. It's very severe.
So then I'm sure for the severe, there are medical treatments available. Could you talk about those?
For the severe, epinephrine is prescribed, and epinephrine is the only medication that can reverse the symptoms of anaphylaxis.
Well, how important is it that a parent would actually notify someone in the school system that their child has a food allergy? How important is that?
It's very important for the parents to notify the school, particularly the school health staff, so that they can implement a plan of care to prevent exposure to that allergen, as well as to educate staff on what to look for in the event that that student is exposed to that allergen.
And then how would a parent go about reporting to the school system?
If the student's allergy impacts their diet, if they have a food restriction or a food substitution, the parent needs to provide written documentation from a healthcare provider. And that documentation needs to specify the student's allergy and its impact on his diet and the exposure to the allergen. And the Frederick County Public School System's special dietary request form is used for that. If an allergy is mild and an antihistamine is needed, the parent needs to provide a medication authorization form. And if it's severe, if the allergies are severe and epinephrine is needed, they need to provide an authorization for management of anaphylaxis to the school. And those two authorization forms have to be signed by the healthcare provider and the parent before we can administer those medications in the school setting. It's important that those medications are properly labeled in their appropriate packaging, and that's also important.
And where can parents find those forms that you mentioned, the special dietary one and then the medication-related ones?
All forms can be found on the Frederick County Public Schools website. The authorization forms can be found also on the Frederick County Health Department website, and in every school health room you can get a form, both forms.
Okay. Well, what happens behind the scenes once the forms are turned into the school?
Well, with the special dietary request form, that information is shared with cafeteria staff and school health staff, so they can develop a plan of care to take care of the child while they're eating during the school day. The authorization forms, the medication authorization form and the authorization for management of anaphylaxis form, and all the medications, when they get to school, what the RN does is she develops a plan of care with the parent and school staff to minimize the risk of exposure to the allergen for that student, as well as putting procedures in place to, in case the child does experience exposure to the allergen, what they need to do. The nurse shares that healthcare plan with the principal, with the teacher, with cafeteria staff, and any other school staff who need to know. And she also educates school staff on the specific signs and symptoms for that child's anaphylaxis. And she will also train school staff, designated school staff, in epinephrine administration.
That's good. I'm sure that's very reassuring for parents to hear that once they've made the school aware of their child's specific needs, that there's education for the folks who need to know in the school system about that specific child's situation. Oh, that's very good. Well, I know that some parents are aware that there are now a stockpile of epinephrine pens available in all the Frederick County Public Schools for students who might be showing signs and symptoms of anaphylaxis. So why should parents who have children who do have a known risk for anaphylaxis or severe allergies, why do they still need to bring in their own medication authorization forms and their own EpiPens for their children?
There's three main reasons. We administer stock EpiPens if we see a student experiencing two symptoms of anaphylaxis from two different body systems. So if we see a child who is having difficulty breathing and vomiting, we know that the respiratory system and the gut is impacted. Some of our known anaphylactic students, though, may only experience one symptom prior to getting their epinephrine. And if we don't have an order, a specific order stating that, we can't give the stock epi unless they show up with another or they show another symptom. The second reason is that we don't give antihistamines with epinephrine, and many of our known anaphylactic students, they do normally have an antihistamine given with epinephrine. If we don't have an order stating that, we will just give the stock EpiPen. And then the third reason is we do not administer stock EpiPens on field trips. So all of our known anaphylactic kids, if they have their specific order, they will be taking that order and the medication on the field trip with them.
Okay, well, I think you just provided three really good reasons for parents who know that their child is at risk for anaphylaxis to make sure that they have for their child a medication authorization form at the school each year, I guess,
Yes.
and that they also have a current prescription, a current EpiPen actually available at the school for their child to make sure their child gets the individual care per their doctor's order.
That's right, right. Because we can better address their specific needs if we have a specific order and the medication.
Okay, very good. Well, you've covered a lot of information. Is there anything else you'd like to add?
Just a couple of things. It's important to note that any child who experiences anaphylaxis and epinephrine is administered, we always call 911 and they are transported to the hospital. And I encourage all parents who have children with food allergies to utilize their school registered nurse. She's a great resource and a great support. And the Food Allergy and Anaphylaxis Network is another great website for parents as well as anybody who would like to know more about food allergies.
Well, very good. Thank you very much for joining us. And I know I learned a lot, and I'm sure our viewers have too.
Thank you.
And now please stay tuned for this month's Medical Myth.
So you can't save money? That's easy as pie. Brown bagging lunch instead of going out. $6 save times 5 days a week times 10 years is $21,000. That's a lot of lettuce. Small changes today, big bucks tomorrow. Feedthepig.org.
And now here's this month's Medical Myths. Welcome to this month's Medical Myths. Today we'll be talking about oral health. One myth is that people think that if you have a cavity, they will know it. Well, mild tooth decay doesn't cause symptoms. The pain we associate with cavities comes when tooth decay is more advanced and then causes damage to the nerve. Another myth is that mouthwash is a substitute for flossing or brushing. The fact is, mouthwash may make your mouth feel clean, and it does kill bacteria for about 30 seconds, but after that, your mouth is just as susceptible to bacterial invasion, which causes cavities. Another myth is that poor oral health is restricted to the mouth. Well, the fact is that problems in your teeth and in your mouth don't just stay in your mouth. Many studies have shown a relationship between poor dental health and other health problems. Another myth is that brushing is bad for bleeding gums. The fact is that when your gums bleed, That is a sign that plaque and food particles are accumulating along your gum line and the gums have become irritated and inflamed. What you need to do is you need to brush to remove the debris if you want to stop the bleeding. Another myth is that sugar is the only cause of cavities. In reality, it's the acid produced by bacteria in your mouth that causes the cavities. What the bacteria do, however, is digest carbohydrates, and sugar is only one of these types of carbohydrates, as are rice, potatoes, bread, fruit, and vegetables. Aspirin placed next to a tooth will help a toothache is another myth that people say commonly. Well, swallowing aspirin is what helps reduce toothache pain. Since aspirin is acidic, placing it beside the tooth that hurts can actually burn your gum tissue, causing an abscess to form. That's this month's Medical Myths. And now here's Angie Blair with this month's health tip.
Hello, this is Angie Blair, health educator with the Frederick County Health Department. This month's health tip is brought to you by the Food Control Office of the Environmental Health Services Division. Summertime is our favorite time of year to spend time outside. We have 4th of July picnics, family reunions, and neighborhood barbecues. We go camping, hike in the woods, relax on the beach, or take road trips. And at all these events, we usually plan to eat. When shopping for these foods, especially during the warm summer months, select cold foods like meat and poultry last before checkout. Plan to drive directly home. You may want to take a cooler with ice for perishable foods. Once home, place meat and poultry in the refrigerator immediately. Freeze poultry and ground meat that won't be used in 1 or 2 days. Always wash your hands before and after handling food. Soap and water are essential to cleanliness, so if you are going somewhere that will not have running water, bring it with you. When taking food off the grill, use a clean platter. Don't put cooked food on the same platter that held raw meat or poultry. Harmful bacteria present in raw meat and poultry and their juices can contaminate safely cooked food. Meat and poultry cooked on a grill often brown very fast on the outside, but do not reach a safe internal temperature. Use a food thermometer to be sure the food has reached a safe minimum internal temperature. A safe temperature for whole poultry, poultry breasts, and ground poultry is 165 degrees. For ground meats, a safe temperature is 160 degrees. And for beef, pork, lamb, and veal, steaks, roasts, and chops, a safe temperature is 145 degrees. When planning for picnics or family reunions, keep cold food cold and hot food hot. Transport cold foods using coolers with frozen gel packs or ice. When using a cooler, keep it out of the direct sun. Pack beverages in one cooler and perishables in a separate cooler. To keep hot foods safe, keep them at 140 degrees or above. Cold foods must be kept at 40 degrees or below. Bacteria grow rapidly between 40 and 140 degrees. Discard all perishable foods such as meat, poultry, eggs, and casseroles left at room temperature longer than 2 hours, and discard in 1 hour when temperatures are above 90 degrees. This includes leftovers brought from restaurants and taken home. For more information regarding safe food handling, please visit the USDA's Food Safety and Inspection Service website. Thank you for tuning in to this month's Health Tip.
And thank you for joining us for this month's edition of Focus on Health. Please join us next month.